What is cleanliness? This is the question to ask as the United States grapples with one of the largest public health scares in modern times. The looming pandemic has shaped our lives for the past year, but clean water has shaped it from the start. Looking at the book, How We Got to Now, specifically the chapter entitled Clean, as a reference to understanding how modern amenities, such as a faucet full of drinkable water, emerged from the cesspools of the 1800s. Building a new sewage system in an existing city is a feat of engineering, even more so a feat for cleanliness. Developing a safe way to clear the city filled of thousands of people of human waste greatly expanded the number of people able to inhabit a town. One of the first major improvements done in American sewage history is the remarkable lifting of Chicago as one of the first examples of the miracles of modern sewage systems in America, given in the book. Ellis Chesborough's endeavor to implement sewage lines in an already existing city is one to be marveled. Raising the city building by building, he implemented new pipelines to carry human waste. This was one example of many in the quest to create clean reservoirs for humanity, one that expanded the concept of a city from an above-ground civilization to the modern definition teeming with life underground. His clever ideas were merely the first of many when considering the massive innovation that followed. While elevating Chicago helped implement a new way to carry human waste away from the city center, it ultimately solved only half the issue. Since the pipelines flowed to the city's primary source for drinking water, many people still suffered at the hands of waterborne illnesses such as cholera. At the time of the understanding of the origin of the disease born from contaminated water was the common theory of miasma, a cloud of bad omens. It was thought that the dark cloud caused the deaths of thousands of people exposed through breathing in the contaminated particles. It was only after a British man, John Snow, sabotaged a contaminated water pump that the first inkling of water as the true villain emerged. Following this historic event, further research led John Leal to add chloride of lime, unbeknownst to Jersey City authorities, to the water supply. The addition of the common disinfectant to the water supply was unthinkable. An interesting exchange within the book is the notes from the trial. While he stood trial for the potential poisoning of a city's population, the overwhelming evidence in favor of his radical new idea spread, eventually becoming a major step in creating safe water for humans everywhere. While water is the lifeline of humans, another important aspect of cleanliness is bathing. For the longest time, lack of access to hot water led to the common conception that bathing equated catching a death. Even among nobility, it was rarely done more than once a month. This lack of using soap and water led to the heavy reliance on perfumes, a common staple of the aristocracy, along with a wig. While soap and water made living with other people a situation ripe with body odor, it also contributed to the high mortality rate of infants. Doctors without germs were far less clean than the modern counterparts. It was proven that the wealthy maternity wards attended by doctors had a higher death rate than the lower income wards with midwives. A primary factor was the lack of washing hands between handling a corpse and delivering a baby. After suggesting doctors not attend birthing mothers after handling a body, Ignace Semmelweis was ridiculed, only to be backed centuries later by proven scientific knowledge. Pioneering forces in public sanitation have led to the modern understanding of bathing, drinking, and swimming. With the rise of clean water came the rise of American summer swim parties, higher hymnlines for women, and ultimately the rise in washing daily. An increase in the access to clean water made waterborne illnesses much less likely, which led to less deaths for new parents. No longer were children expected to die early. The increase in good water led to standing pools meant for swimming, as the now popular pastime of lounging at a local pool helped fashion the way toward less clothes for women. Having clean water changed the mindset of people surrounding very culturally ingrained concepts, allowing people more time to live, to splash, and to smell like roses. While cleaning is a largely positive idea, also mentioned in the book is the consequences of a sterile world. While water is free from cholera, it can also be free from essential minerals. The lack of minerals and other naturally occurring nutrients within the water is harmful. Additionally, the lack of exposure early in childhood to different pathogens may have contributed to a spike in asthma cases. Without the fully developed immune system obtained from drinking out of a stagnant pond, children suffer from the chronic disease due to the padded gloves of sterilization. Another interesting point concluding the chapter is the change of perspectives. Nowadays, a tiny microchip requires sterile rooms to exist. Humans have become the outside force of dirt. One small stray hair can potentially damage expensive parts. The reversal of roles from the object that needs protection from the dirt of the environment to being the only supply of outside debris is paradoxical. Relating the chapter from the book, How We Got to Now, is especially easy given the hyper-focus on cleanliness in a world that currently supplies hand sanitizer every 3 feet. Protecting people from a force they can't see is impossibly difficult, despite knowing germs exist. Cleanliness has changed lives, created space for more people to live together. However, it is still a fight against an object we can't see without a microscope. Discovering how people evolved their habits from sewage-ridden streets of the 1800s to the mysterious water treatment plants of today provokes serious consideration for what the next evolution in cleanliness will bring to a world currently entrenched in antiviral practices.